When I'm often asked, are we turning the corner? My response is really more like we are at the corner. Whether or not we're going to be turning that corner still remains to be seen.
That was Dr. Anthony Fauci in March, talking about where we stood in the pandemic and stressing that we are not out of the woods just yet. Welcome to our In Focus discussion tonight on the current state of COVID-19. Here in Utah, COVID-19 vaccines are now available to anyone over the age of 16 who wants one. Spring is here and the public is ready to get back to normal. So what is the state of the pandemic in Utah? Is the news good? And should we still be worried? Tonight, we look at the data of where we are with the pandemic. Joining us tonight live via Zoom is Erin Clouse. Erin is the Strategic Engagement Manager for University of Utah Health. We are going to be spending the entire show going through her data and research. Erin, thank you so much for joining us tonight and welcome to the show.
Thank you so much, Rosie, for having me.
Erin, let's begin with the type of work that you do. Can you tell us a little bit about what you've been studying and researching during the COVID-19 pandemic?
Sure. I've taken the time to stay connected to the pandemic by looking at the data. That's how I kind of dealt with being sent home and having my kids home. I just dove right into the data to see what was going on for myself. And what I've done is taken state data, national data, and revisualized it in a way that was really approachable, really simple, and ways that I could easily understand what was going on in the pandemic.
And we are looking forward to diving into the data with you. Now, Utah seems to be trending in the right direction as far as getting a handle on COVID cases. The rolling 7-day average seems to be in a downward trend. What are you seeing in the data?
I think what you're saying is exactly right. I'm seeing the data trend down right now. What we see is the positivity rates. It's the first indicator of transmission in our community. That has been trending down since January. And that's the number of, the way that I plot it is out of 100 tests that are run, how many people are positive? And that is now, it's gone way down. I think it's down between 5 and 10% now each day on a rolling day, seven day average.
Now, is this happening for everyone in the state, even those under the age of 16 who have not had access to the vaccine yet?
Yes, so we've seen the decline in cases even before vaccinations were available, and we've seen the decline in every age range. What we've seen most recently is the oldest age groups, those 65 and up, have had the steepest decline. And you can see that on this chart here on the right. It's a dark blue and maybe like a light purple color to you. Those have recently had a really steep decline. And those age groups are the most fully vaccinated. They received the vaccinations first. And we've seen the decline in new cases in those age groups go down the fastest.
And we really can't deny that impact that we started to see around December, January, when that vaccination rollout started to kick off in our state. Now, when it comes to the pandemic, a key metric is the number of people in the hospital being treated for COVID. Why is that? And what are you seeing there in the data?
So I look at hospitalizations as one of the real indicators for how serious or how much COVID has spread in our community, because regardless of how you feel about masking or how serious the virus is, if you get really sick and require hospitalization, you're going to go to the hospital. And so these numbers can't really be denied. We saw when there were more cases of COVID-19, hospitalizations went up. And now that cases are coming down again, we see hospitalizations also coming down. It's a really great sign.
And I really remember at that point when some hospital leaders were talking about, they were worried that we were really pushing capacity. Luckily, we've never had to get to that part where doctors had to choose who got the care and who didn't. Now, the virus has affected us all in some way, shape, or form, but it has hurt families the most who have lost loved ones. What can you tell us as far as what we're seeing elsewhere or additional information when it comes to deaths?
So first, I think I can speak for many, many people that my heart goes out to anyone who's lost a loved one to COVID-19. I think it's a tragedy. Luckily, what we're seeing in our numbers in Utah, cases are coming down, and very simply stated, when cases come down, deaths they're also coming down. And as you can see, this red line shows us the most recent 7 days, how many people on average have died from COVID-19. In the most recent data, you can see that number has come way down. Unfortunately, in the peak of the pandemic, more people were dying each day from COVID-19 than they were dying of cancer or heart disease. The blue line on this chart, I think, is really interesting and something to note. It's an overall. If we look at the pandemic over all of the days, how many people have died on average per day? And that average shows us that COVID-19 is the third leading cause of death in the state of Utah. And that trend holds true nationally as well. So although COVID-19 is very serious, we should take the precautions seriously. What we also need to think about as a population and community is that preventive screenings and our wellness checks with our physicians are just as important to prevent unnecessary death and cancer and heart disease as well.
Yeah, COVID-19 really shed a light on what we need to do on a daily, weekly, yearly basis when it comes to our health. Okay, Erin, hold that thought. We do have to take a quick commercial break, but when we return, we'll resume our In Focus discussion on the current state of COVID-19.
It's pretty undeniable at this point, where we've now administered more than 1 million doses of the vaccine, that the vaccine is starting to impact our case counts in Utah, and that's a great thing.
That was Tom Hidako, spokesperson for the Utah Department of Health, talking about how the vaccines have contributed to the declining numbers of COVID-19 cases in our state. Thanks for staying with us for our second In Focus discussion tonight on the current state of COVID-19. Before the break, Erin Clouse, the Strategic Engagement Manager for University of Utah Health, joined us live via Zoom. We pick up now right where we left off. Erin, let's talk about Utah's vaccination program. How is Utah doing in raw numbers compared to our population? And for instance, getting shots into arms, are we average, ahead, or lagging?
That's a great question. I think Utah is doing great, and anyone who's experienced any one of these mass vaccination events, you can see this seamless process they've put into place. Me personally, in and out in just over the waiting period time. So I think kudos to the how organized and how great these events are going. When we look at Utah, just like you heard in the clip to start this segment, over 1 million vaccine doses, 500,000 people are fully vaccinated in the state. I think that we've done a really great job getting shots in the arms of the eligible people. Not only that, but we've done a great job at administering the doses that we've received, with greater than 80% of the doses that we've received as a state have been administered and put into people's arms. So I think that's just a great statistic. We're doing a really good job in getting this done.
I agree with you. I'm also impressed. I also got vaccinated with the Johnson & Johnson vaccine over the weekend, and same with you. In and out, and just out of there after the 15-minute waiting period. So very proud to see where our state has come. Now, we have a very young population, about 1/3, who are under the age of 18. Does that affect where we stand nationwide?
Absolutely. So if we look at our population's eligibility to receive the vaccine, we have a meaningful portion of the population that aren't even eligible to receive the vaccine because there's no vaccine approved for them yet. So if we look at overall our population and what percent is vaccinated, because our state is so young, it will look lower than other states that have an older population and more people that are eligible to receive the vaccine right now.
And I think that's something really crucial to point out, so that when we look at numbers, we know that there is that factor in there. Erin, can you talk about access to the vaccine across age groups? Where do we stand compared to other states?
So I think the chart that you'll show, we have a really great, we've done a great job at getting to the older populations. I believe 70% of the oldest populations are fully vaccinated at this point. And when we look at states that surround us, we're one of the only states, well, there's a good handful of states now, but that are offering the vaccine to those people 16 and older. So in the state of Utah, anyone 16 or older can receive the vaccine now, and not all states have gotten to that point yet. And I think that's another point and nod to our young population. We were able to vaccinate the mass mass majority of the older population already, and we've been able to open up to the younger groups.
And I know that we have exceeded our expectations for the deadlines. I remember at the beginning of the year, our governor said that we will probably get everybody who wants a vaccine by summer, but it was only March when we were able to do this. So pretty incredible. Erin, how is Utah trending for getting vaccinations out across all age groups?
Yeah, great question. We've seen the older age groups really, as soon as they were eligible to receive the vaccine, they jumped right up, they got in there, and the age groups that are 65 and older, over 80% of them have had at least one dose, which I think is really spectacular. The younger age groups here, you can see as soon as they were eligible, that line jumps right up again, and you can see the numbers, the percentage of that population jumping up and getting at least one vaccination as well.
Erin, where do we stand right now in terms of vaccinations, as in the percentage of people who are fully vaccinated, partially vaccinated, or have had no shots?
Thank you for asking that question. So on the next chart that you'll see, we have broken out the age groups again. And this chart has a bit, and I'll explain it to you. So the orange bars, those bars indicate and represent the percent of the population that's fully vaccinated. So that's one Johnson & Johnson vaccine or two of either the Pfizer or the Moderna shot. The gray bar is the percent of the population that's received one dose. And then the blue box at the top indicates and represents the percent of the population with at least one dose. So they're one shot in or they've had two shots, but this is the total. The yellow line in the background shows the size of the population. And the reason I put the population size on here is to show that although the older age groups, we've gotten these populations, majority of them, over 70% at this point with the orange bars, fully vaccinated. As we look to the younger age groups and as we open up to 16 and older in the state of Utah, we have to remember that those populations in the younger groups are much bigger. For us to get up to that 70% or more to be fully vaccinated, it is simply more shots that have to go in arms. And when I see this chart, what I think is we probably still have more vaccinations to do ahead of us than we've done already.
So interesting to see the breakdown of your data collection here. Erin, thank you so much for explaining that to us. And hold that thought, we have to take another quick commercial break. But when we return, we'll resume our In Focus discussion on the current state of COVID-19.
That have yet to be vaccinated, those are the ones that we're actually starting to see a rise in hospitalization.
That was Dr. John Brownstein, who lives and works in Massachusetts, talking about the uptick in COVID-19 cases in his state. Welcome to our third and final In Focus discussion tonight on the current state of COVID-19. Before the break, Erin Clouse, the Strategic Engagement Manager for University of Utah Health, joined us live via Zoom. We pick up now right where we left off. Erin, while Utah is trending in the right direction, there is still a lot to be concerned about. Can you talk about the different spikes or waves in cases that we have experienced?
Yes, happy to. So one of the things that I look at is Utah, what's going on in Utah. But to help me understand Utah better, I take a look at what's going on nationally. How do we compare? What's going on in the bigger picture in our country? So this chart that you'll see, it's a lot. There's a lot of lines and a lot going on. But what I want you to see in it and focus on are the different waves. Each one of these lines represents a different state in our country. And the lines are measuring the rate, and it's normalized to population. And what I mean is we're not just seeing cases from the biggest states because there's more people there. So it's the number of cases per 100,000 people in the population. And this normalizes us. And what we can see here is which state has the fastest rate of new cases each day. So what we saw at the beginning on the left-hand side of this chart in March, it's when we closed schools or sent them home virtually, and remote work started, and we started, condensing shopping trips and doing all of that. And we saw peaks, and those peaks early on in the pandemic, remember, it was New York, Massachusetts, Michigan, California. And then that came down. And when it came down, we started to get more relaxed again, and temperatures got warm. Memorial Day hit, people got together, and we saw another peak, and that's wave 2. And that came down. And then you'll see right around September, schools opened. The high school, college age students actually in the state of Utah is where we saw this peak start, this wave start in Utah was in that age range. And this spread through the holiday season. Lots of gatherings, lots of people being together indoors because it's cold, probably with the windows shut. So there's just more chances of virus being in that enclosed environment. We've finally seen this wave, the third wave, come down. What I'm starting to see nationally as I look is that there are states that are coming back up, and they indicate the beginnings of a fourth wave. What's interesting to note is the same states that were in the first wave, New York, New Jersey, California, Michigan, those are the same states, again, that are manifesting and showing up in this fourth wave.
It's just so interesting how we can see some of the patterns, right? Summer, the start of school, the holidays, just impacting when we see these different waves. Erin, thank you so much for explaining all of that. Can you make an analysis on the states that are showing a rise in cases right now? Anything about their demographics or anything tied to their vaccine rollouts?
You know, I think I can't speak to the demographics or the vaccine rollouts in any individual state. But what I do know is that this virus doesn't care. It doesn't care what you look like or what you believe in. It is simply just looking to the next person to infect. If you give it the opportunity, it will take the opportunity. So in states that are seeing increased cases, one must assume that there have been more opportunities for the virus to spread, and that's fewer people wearing masks, more large gatherings, and other things like that. All of those things that we've heard of that we shouldn't do probably have happened, and that's why cases are coming back up in areas. It's just an opportunity that the virus will take.
Now, Erin, taking all of this data that you've discussed in our segment tonight, what concerns you the most when we look ahead to the upcoming months?
So I think my concern is as restrictions are lifted, there may be a false sense of security that everything's fine, that the virus is over, and that you don't have to heed the public health warnings anymore. And I'd say that's just not true. In the beginning of this segment, we heard Dr. Fauci say we're at this corner. We might turn the corner, right? And it's just going to take everyone continuing to wear their masks and practice good, physical distancing and really heeding the public health warnings to make sure we can turn this corner together.
Right, and we've heard health officials say that even if you are fully vaccinated, that doesn't give you a free pass, right, to just go and resume your life as normal. Now, Erin, I've asked you a lot of questions during this segment. I'd like to give you the final word. What would you like to leave our viewers with tonight, or what is something that you'd like to mention that we haven't yet addressed?
Thank you. I think that what I'd like to leave everyone with is I'm tired of this too. I'm tired of not being able to see my family and friends the way that I want to. I'm tired of missing people that I haven't seen. And I'm okay still wearing my mask. I'm okay staying home. I'm okay keeping my family safe. And we can turn this corner together. And really the other thing I wanted to make sure that people understand is our health systems are safe. Seeking care from your physician for wellness exams and preventive exams are necessary and good, and we should keep doing those.
Well said. And I look at this pandemic as a marathon. We are on the last mile. Don't give up. We are almost there to the finish line. All right, you've been hearing from Erin Clouse, the Strategic Engagement Manager for University of Utah Health, who joined us live via Zoom. Erin, thank you so much for spending your Friday evening with us to share all of the data from your research. We appreciate your time.
Thank you for having me.